The second segment of the nightly news is brought to you by Labrie Credit Union. Labrie Credit Union. We are not a bank. We are better. Welcome back. As COVID-19 infections keep increasing and the much dreaded shortage of staff and bed space becomes a reality, a young nurse takes to social media to admonish the public. She speaks on the plight of nurses at the facility and the physical and psychological effects that the loss of lives has had on them.
I am talking to you right now as a frustrated healthcare provider. COVID-19 is no joke. I cannot understand how I still see people walking around without a face mask or people gathering in large numbers. Do you want to come to the respiratory hospital? Do you think it is fun if you have COVID-19? Can you imagine being unable to speak? Having chest pains? Can you imagine being so weak, having difficulty breathing that you think you will die? Having so much mucus that you have to be spitting all the time? People, take care of yourselves. Follow the protocol and stop blaming the government. Okay? The government is not responsible for you not wearing your face mask, not sanitizing your hands, not maintaining social distance, still gathering in large numbers, and doing all kinds of things you're not supposed to be doing. Blame yourself. If you don't want to follow the protocols for yourself, follow them for me. Follow them for the healthcare providers. Imagine being in personal protective equipment for an extended period of time. You have 2 face masks on. You have a simple face mask, then you have the N95. Plus, you have a face shield. Then you have your gown, you have a cap, plus you have shoe covers on you. When you're doing a procedure, you can hardly see because of all of the sweat. You have difficulty breathing. Take care of yourselves. The hospital is so crowded right now. We do not have space for people. People, take care of yourselves. Stay at your homes. Do what you're supposed to do. When you're at your home, isolate. Stop making people come at your home to visit you. This is very serious, and it is just so surprising that a lot of persons are not taking it as serious as it is. People, we are frustrated. We are tired. Every day I have to leave work how late? I have so many things to do, and I am just one person and I have so many persons to take care of. Obviously, care will be compromised, and it is no joke. We have limited staff, we have limited resources, we have limited PPEs. I don't know what to tell you again, but take care of yourself. It is really frustrating, and it is really frustrating to see that we are trying our best at the hospitals, and persons are still going on social media and talking about the nurses this, the nurses that. We are trying our best. So do your part so you'll not have to come to the hospital. And some persons are saying we are causing patients to die. That is not true. Do you know the psychological effect it has on you to constantly see persons taking their last breath? I can tell you, most days when I'm at work, I want to cry. Because I am seeing we are trying our best. We are doing so much, yet still persons are just dying.
Because of the pressure on healthcare personnel resulting from the COVID-19 pandemic, the Health Ministry had to temporarily close some health facilities and strategically reassign staff.
In response to this situation, and to improve efficiency in the delivery of care, the Ministry of Health shall temporarily close the following community wellness centers: Lague Babuno, Tiroche Castries, Delce Soufre, and Fort Saint-Jacques Soufre. Clients of these wellness centers are asked to access care at another wellness center within the district. During the closure of these wellness centers, the health aides will continue to provide screening services within the communities. Additionally, the ministry has taken the decision to scale down the services offered at select wellness centers. This will allow for the reassignment of staff to facilities and sites with higher service demand, including vaccination sites and respiratory clinics. Despite this redeployment, core services will still be provided at these downscaled wellness centers, which include the continuation of diabetes, hypertension, and other chronic care services such as the maternal and child health services. The clinic days for these wellness centers are as follows. Canris Wellness Center, Tuesdays and Wednesdays. Vanna Wellness Center, Mondays and Tuesdays. Etangs Wellness Center, Tuesdays and Wednesdays. Saltibus Wellness Center, Tuesdays. The Grace Wellness Center on Wednesdays. The Tiroshe Miku Wellness Center on Mondays and Thursdays. And the Moguj Wellness Center on Tuesdays and Wednesdays. All scheduled doctors' clinics will remain as per schedule. This scale down will be for a period of 2 weeks in the first instance, commencing Monday, September 20th, 2021, and at the end of the period, an assessment will be done to determine the need for its continuity. The Ministry of Health recognizes that these changes may be inconvenient for some members of the public, but requests patience and cooperation as we attempt to meet the healthcare service needs to respond to the COVID-19 situation in St. Lucia. The public will be kept updated of any further changes that may be taking place in the delivery of community wellness center services. The Ministry of Health once again encourages individuals to get vaccinated to reduce the impact of the COVID-19 virus.
In Jamaica, Cabinet Minister Floyd Green has been sacked from the Cabinet of Ministers after he was discovered breaking COVID-19 protocols. Minister Green was seen in a viral video partying at a hotel with a group of friends on a designated No Movement Day. More in this report.
Disappointed. That was the Prime Minister's first reaction when he saw the video involving Floyd Green and others, including the Councillor for the Mona Division, Andrew Bellamy.
Minister Green himself, having reflected upon it, also expressed his own disappointment and recommitted to ensuring that no such other incident ever occurred.
And as for the others in the video,
we are examining the situation with Councillor Bellamy, and you will hear shortly. And it's not just Councillor Bellamy, there are other persons in the video that we have to look at carefully. So, I have referred the video to the police, and we need advice to see what other actions need to be taken.
Mr. Holness argues that for the COVID-19 containment measures to work, people must follow the rules.
For us to properly manage this pandemic, enforcement is not the tool. We don't have the resources to enforce on every single Jamaican. We manage this pandemic because we have managed to build tremendous social capital. We have managed to get the people on board to follow the protocols, to follow the orders under the DRMA. So we have not relied heavily on enforcement. We have relied on the trust and confidence of the people in voluntary compliance.
He says it is important for government officials to practice what they preach. In other words, he argues that it does not look good for the government to tell people to comply with the COVID-19 measures while blatantly breaching the rules.
And I think Minister Green recognized this, that it was important that ministers exemplify the law, and what he did is admirable in offering his resignation, and indeed there was no option other than to, it was the right thing, and he did the right thing. It is a loss for the cabinet. Minister Green shows great potential, and a part of our discussion was how we could utilize the experience that he would have gained in government in other areas.
The Prime Minister says he will work out the details regarding how Mr. Green's talents will be used by the government. Vashon Brown, TVJ News.
Voters in the Bahamas ousted Prime Minister Hubert Minnis in a snap election on Thursday as the economy struggles to recover from its deepest crash since at least 1971. Minnis conceded and congratulated his rival, Philip Brave Davis, according to a resignation letter published in a local newspaper, the Nassau Guardian. In his victory speech, Davis said the population is yearning for renewal. Stay tuned. We'll be right back.
second segment of the Nightly News was brought to you by Labrie Credit Union. Labrie Credit Union. We are not a bank. We are better.